Welcome and thank you for joining us today. Every year, the Centers for Medicare and Medicaid Services uses a 5-star quality rating system to measure the experiences Medicare members have with their health plan, a measurement of how well Medicare Advantage and Part D plans perform. Improving star ratings and maintaining high ratings can be difficult. Every year, the quality thresholds increase. This year, improving the customer experience is a CMS imperative with a notable emphasis on medication adherence, member engagement, and member retention. Finding the right holistic approach to improving health plan performance and the quality of care delivered to beneficiaries requires a concentrated effort using the right tools. Today, our focus is on showing how ConnectSureDRX's DatabaseRX can improve star ratings by helping to increase medication adherence. It is my pleasure to introduce our speakers, Amanda Woodman, Sales Executive, and Jeremy Hayes, Health Plan Market Leader. I'm Cara Tarantino, Marketing Director, and we are all with ConnectSureDRX. You may have joined our August webinar on the power of therapeutic interchange with Amanda and our clinical team. I invite you to visit our YouTube site to review webinar recordings where you can gain more in-depth insight into DatabaseRX and therapeutic interchange from a more clinical perspective. Today, we will address the problems DatabaseRX is solving specific to STAR's improvement opportunities. We'll offer case study examples from both the health plan and member views and show how each one benefits, discuss how Drug Compare, a solution you may already be familiar with, works synergistically with DatabaseRX, and finally, the potential savings for your health plan through our savings analysis that includes your own data. And with that, I'll turn the presentation over to Jeremy to get us started.
Thank you, Cara. ConnectSureDRX has been around since 2000. Many of you might know us better as DestinationRx. In 2013, DestinationRx was acquired by ConnectSure to add Medicare and drug transparency to their overall product suite. In 2019, we shifted our focus back to Medicare. We also added DRX back to our brand to let people know we are back to focusing on bringing innovative solutions to the Medicare industry. As a software company, we provide solutions to health plans, pharmacy benefit managers, and field marketing organizations, all with the goal of providing beneficiaries with their best fit Medicare plan and medications. We also provide the largest Medicare distribution network that connects health plans to agencies and agents. This provides health plans with an easy way to get their products in front of as many agents as possible and allows integration with ConnectSureDRX to receive enrollments electronically. Agencies and agents benefit by having access to the largest database of Medicare products with the ability to enroll their customers via one platform. We have more than 20 years of experience developing innovative solutions for health plans and other organizations servicing the Medicare population. We've been engaging consumers directly in our annual Voice of Consumer survey. This year will be our 9th year of doing the survey. In this time, we have collected responses from more than 16,000 consumers on their shopping and enrollment behaviors. These surveys provide us with data and insights we use to support our research and development. We also have a unique focus on member retention as our technology is uniquely designed to support member engagement, protect brands, and build plan loyalty. You may know us as drug pricing experts as our data is most accurate in the industry. We leverage plan data directly from the carrier, and now we source pricing at the pharmacy level. We update our pricing every 2 weeks and never use regional averages. In fact, we currently provide drug pricing and transparency services to 95% of the Medicare Part D market. It's important to point out that we're not just technology and drug transparency company. Although both are our core strengths, we also provide ourselves on the strengths of our clinical and analytic capabilities, which you will learn more about today. Today, we're going to discuss our DatabaseRX therapeutic interchange solution and the power it has to address real-world healthcare problems. Some of the challenges that we face today include going beyond generics to look at lower cost alternative and options, drug shortages, price transparency, and the last, star ratings, which is what we are discussing today. We will be providing examples on how DatabaseRX can help health plans empower members to improve medication adherence, which can ultimately elevate your stars ratings. You'll see that it's all about being proactive with your members by connecting them with personalized prescription data that allows them to engage with their doctors or pharmacists. According to a 2019 Kaiser Family Foundation report, many seniors have difficulty affording their medications and taking them as prescribed. As a result, nearly 80% said their condition worsened due to not taking their medications. The cost of medications has been shown to be one of the biggest barriers to adherence, if not the biggest. As studies have shown, when drugs cost less, members are more apt to follow their prescribed treatments, which leads to better health outcomes. We all know unfilled prescriptions can lead to an increased health risk for the member. The importance of medication adherence is even reflected in CMS STARS ratings. Out of the 46 members for 2020, 17 of them were related to medication management and adherence. In determining STARS ratings, as stated before, medication-related measures influence approximately 50% of the health plan's performance. Many conditions can be treated and managed with medication, including diabetes, cholesterol, and hypertension. When medication-related behaviors influence about 50% of the STARS ratings, it is critical for health plans to support and influence members in taking their medications as prescribed. As mentioned earlier, in 2020, there were 17 medication-related measures. 15 of them are tied directly to medication adherence, with a focus on health impacts and consumer experience. 2 measures pertain to the year-over-year medication improvement impacting the health plan's overall improvement. Within these measures, medication adherence for diabetes, hypertension, cholesterol, and statin use in persons with diabetes were triple weighted. An item to note is that the consumer assessment of healthcare providers and systems includes quadruple weighted measure for Part D in 2021. So why is this relevant? Improved STAR ratings can also impact the overall financials for a health plan. Studies have shown the higher STARS ratings can influence overall enrollments and drive membership growth. In addition to increased revenues for membership growth, Medicare Advantage plans that are currently rated 4 and 5 stars receive approximately $500 per member per year. This financial impact of STAR ratings has created tremendous motivation for Medicare Advantage organizations to explore a variety of methods to improve their STAR ratings. Many models for improvement are aimed at improving specific measurements in the rating system, including HEDIS measures, health outcome surveys, CAHPS, and consumer health surveys for health systems. According to CMS in 2020, approximately 48% of Medicare Advantage plans were still rated with less than 4 stars and not yet eligible for these incentives. By focusing efforts on these medication adherence measures, Medicare Advantage plans can maintain or increase their STAR ratings, which not only translates to healthier outcomes for the members, but also provides additional financial incentives. This year, more attention is given to a new CMS measure regarding health plans and the consumer experience. The CMS May 2020 rule says that the consumer experience will now carry more weight in determining a plan STAR rating. It's clear that the consumer experience needs to be a year-round health plan focus with emphasis on medication adherence. According to the American Journal of Managed Care, improving the consumer experience and medication adherence measures will have a direct and near-term effect on improving STARS ratings. Higher STAR ratings increase health plan reimbursement, along with the ability to attract and retain members. As you look at areas of improvement to address this new measure, keep in mind that engaging members with solutions that positively address their health outcomes can reduce disenrollments and increase overall retention. Keep members with you and stay ahead of disenrollment to keep your STAR ratings high. And now I'd like to introduce Amanda Woodman, who will be talking more about our DatabaseRX solution.
Thank you, Jeremy. So what is DatabaseRX and how is it used? DatabaseRX is an extensive repository of therapeutic interchange medications options. Therapeutic interchange means you can take one drug and replace it with another drug comparable in effectiveness with a prescription. The power of therapeutic interchange can be incorporated into a member prescriber-facing tool, an analytics engine, or a drug database to identify cost savings strategies for health plans and members through the presentment of lower-cost drug options. It goes beyond replacing high-cost prescription medications with generic equivalents and can incorporate other comparable brand, generic, and over-the-counter medications. All therapeutic interchange programs should be evidence-based, meaning the rationale behind the program should be based on clinical effectiveness research and other medical literature. This is important because there's usually more than one drug available to treat a particular condition. However, clinical evidence can show which drugs can be interchanged for each other and under what circumstances it would be appropriate. This is why extensive and ongoing research is necessary. At ConnectSureDRX, we have one of the most comprehensive therapeutic interchange databases used by health plans and PBMs for over 20 years. We also use data from multiple drug data warehouses like Metaspan and FDB. Currently, ConnectSure's therapeutic interchange database has over 140 drug classes with over 42,000 active NDCs. And there are more than 50 million searches done annually on our database. All therapeutic classes are created and maintained by pharmacists. Our pharmacists review a large amount of medical literature to identify which drugs and at what doses can be interchanged for different conditions. Then, certified physicians who are all practicing in their respective settings review what has been created to ensure it is consistent with current practice trends and what they're seeing with their patients. Here we share the clinical review process from the pharmacist to the physician to integration with the database and then daily maintenance review, which is critical to ensure newly improved drugs are included along with newly published guidelines. ConnectSureDRX provides the analytics and reporting that includes the prescription data that is sent to members regarding their current medications and alternatives they can speak to their prescribers about. Our solution touches on 4 key areas: transparency, providing visibility into drug costs, plan coverage, and therapeutic options; cost savings, reducing members' drug costs also reduces your pharmaceutical and chronic condition costs; healthier members, making pharmaceutical treatment more affordable for members increases adherence and leads to healthier outcomes; and proven results. With our 20-year history and over 65 million covered lives, we can boast a savings of 58% per therapeutic option. This is a product backed by an experienced clinical team that the largest health plans in the country and industry leaders rely upon year over year to deliver the results they need. Here's where we see the power of the data at the summary level and the savings opportunity for one health plan. This chart shows the savings by category and condition. So for example, let's look at diabetes and insulin. As we know, diabetes is a big problem in this country. Over 34 million people in the United States suffer from this condition. Insulin prices, meanwhile, continue to go up and have tripled in the past 10 years. As you can see from this example, we have identified over 26 million in savings on insulin alone. You can develop your programs and initiatives based on the data. This shows the opportunities with the different drug classes that will enable you to develop highly targeted, proactive campaigns. From our research, we know members are more likely to take action to switch from a high-cost medication when their carrier provides visibility and clear messaging based on accurate data. A proactive approach paves the way for more informed members, which ultimately improves STARS ratings. Here's a sample report we would provide, including member-level data and the associated savings generated by the alternatives. With this report, you can identify and target key members, especially those on high-cost medications who would benefit the most from the savings. You can target based on certain drug classes, thresholds, and more. You can also offer our member-facing drug compare tools in tandem for self-service comparison and evaluation of drug options. Armed with this information, you can inform your members of the savings by switching, along with the savings over a year if taking the drug regularly. Once the data is analyzed, health plans can begin outreach programs to the members identified on high-cost medications. These outreach programs can consist of communications via email, text message, or direct mail, encouraging members to speak to their physicians about the alternatives listed or directing them to do research on a site like Drug Compare so that they are fully aware of their options. While getting individuals to switch prescriptions can be a difficult process when even a small portion of the targeted members make the switch, the savings gains, as we saw in the previous case study, can be substantial. Given the rising cost of medications and the current economic climate, presenting members with hundreds or potentially thousands of dollars in savings can be a key differentiator in medication adherence and member-carrier relationships. So how do people even know their options? Johnnye Denman is from Jackson, Mississippi, and she shared her story regarding the high cost of EpiPen with patientsforaffordablедrugs.org. Johnnye uses EpiPen to prevent allergic reactions, and due to the high cost of the drug, she doesn't have the EpiPen on hand and is hoping she's never in a position where she actually needs one. As we mentioned earlier, direct generics are not always the lowest cost options, and it's important to look at the differences in price. In this specific case, let's review how we can help Johnnye by providing therapeutic alternatives instead of just a direct generic. Here, we averaged out the cost per unit for different brand and generic drugs using CMS retail pharmacy pricing. These costs represent what health plans are paying for these medications, a portion of which is then passed on to their members as co-pays or co-insurance. The average Medicare cost of EpiPen is $310 per unit. Its direct generic, epinephrine, is $161, which is a 20% savings. Our database generated a brand alternative option called Symjepi at just $133, which is a savings of over 50% off the brand. With this information, here's what Johnnye's health plan could communicate to her. We understand the significant cost you are paying for EpiPen at $310 per pen. We recommend you speak with your prescriber about an option that is significantly lower called Symjepi at $133 per pen to ensure you have one with you at all times. Given cost is preventing Johnnye from having an EpiPen on hand, now she has a cost-effective option that can prevent a greater health problem in the future. Also, if Johnnye's carrier has provided her access to our drug compare tool, she doesn't have to wait. She can self-serve right from her member portal to look for lower cost options. Angel's story. Angel was diagnosed with rheumatoid arthritis at 39. Her doctor prescribed Humira. When she found out the drug cost $3,200, she was shocked and went without the prescription for 2 years. Although Angel is fortunate her insurance is covering Humira, there is still a major savings opportunity here for both her and the health plan, along with great opportunity to increase member retention by connecting with a member about her unique situation. Her health plan can communicate with Angel via voice, text, email, or direct mail and let her know about an available therapeutic option called Cimzia that requires half the dosing of Humira and encourage her to speak to her doctor about this option. In this example, the savings is $1,000 a month for the plan, and depending on coinsurance and other costs, will most likely save Angel as well. Plus, it'll help her adhere to her treatment regimen. So we want to show you how we arrived at these savings. As you know, rheumatoid arthritis is a costly condition requiring consistent aggressive treatment for many years to control symptoms, manage pain, and stop disease progression. RA is estimated to cost $19 billion a year in the US, with many patients paying up to $30,000 annually for their medication costs alone. Those with insurance can still end up paying 30% or more of the total cost of certain medications. In our case study example in the previous slide, on the savings overview, we showed the top costly conditions and the savings for rheumatoid arthritis, which is over $31 million. If we look at the specific drugs in the rheumatoid arthritis category, we can see that Humira was prescribed in our claims study about 21,000 times at an average cost per unit of $2,600. When comparing Humira to other drugs and considering efficacy as well, we find that Cimzia costs $4,400 per unit, but requires half the dosing of Humira. This means that switching all 21,000 units for Humira to Cimzia resulted in a savings of over $8.4 million, and that's just for one drug. DatabaseRX and Drug Compare are two tools that work together harmoniously. With DatabaseRX, we provide health plans with the data needed to proactively connect members to lower cost therapeutic options to improve medication adherence and star ratings. Drug Compare, on the other hand, is a complementary tool that enables members to search for therapeutic alternatives and drug pricing in a self-service capacity. Additionally to what we discussed today, we are working to have the DatabaseRX solution dynamically integrated into existing programs such as medication therapy management to help consumers better understand their health and conditions, at the point of prescribing to provide visibility into alternatives and pricing respective to a patient's plan to ensure a lowest cost option before it reaches the pharmacy, with options for data transmittable via API to existing EHR systems to create a seamless experience for providers and their patients. In-pharmacy messaging to present formulary and low-cost information to pharmacists to provide better guidance to their members filling prescriptions, and drug pricing analytics to provide insights into trends, deviations, and usage based on ConnectSureDRX's pricing index on an ongoing basis. Big data analytics continues to be an emerging technology in the healthcare space. While information is becoming more electronic, the tools for extracting, transforming, and interpreting that information lags in healthcare due to fragmented internal systems, often acting in silos. Data security and HIPAA compliance rules, while critical for safeguarding personal health information, also presents a significant barrier in getting data science initiatives off the ground. The analytics engine powering our case studies is an excellent tool for giving health plans visibility into their membership's drug utilization and therapeutic interchange opportunities. It runs off de-identified claims data, so no personal health information needs to be exchanged. For Part D plans, the analytics use the same formulary and pricing information carriers already submit to CMS, or in many cases already submit to ConnectSureDRX for our plan shopping tools. If no plan pricing is available, the analysis can utilize cost information derived from the claims data itself to build pricing models for therapeutic interchange comparison. The result is a detailed savings report with both member level and health plan level views. The DatabaseRX solution empowers you to target the members that can most effectively enhance your star ratings. To implement the solution, we begin with the savings analysis, which consists of collecting your health plan data and de-identified claims to be run through the database, which allows us to provide the projected savings. From there, there's a multitude of options for using the data, and we will work with you to determine the best route of action to achieve the best results. Thank you for joining our webinar today.